All right, there we go. Look at that, huh?
Amazing.
I did a little time lapse. Live from APTA CSM, still on the floor here in Anaheim. Episode is brought to you by Empower EMR. If your clinic is stuck with an EMR that slows you down, Empower gives you speed, clean workflows, and features PTs actually asked for. Who knew? You could do that. You should be doing that. Better notes, faster documentation, smoother operations, all with customer support that doesn't ghost you. Find them online at empoweremr.com. That's empoweremr.com. Most PTs don't realize how many career paths actually exist until they meet someone who took a different one. Our next guest is a professor, clinician, author, social media educator, science communicator with over 1 million followers, helping people learn and relearn and love learning again. Live from Anaheim, Tim Reynolds back on the show. Tim, welcome to the program.
Jimmy, it's good to be here. I'm excited.
What made you want to start doing the Instagrams? Because like these kids today are always on their phones and whatever. And
so 4 years ago, I had students say, you should do a TikTok. And I said, that's a horrible idea. I should not be on social media. And they kept pursuing this idea of me just posting what we're learning in our anatomy and physiology class. And I said, sure, I'll humor it. And I'll just post relevant content in regards to what we're doing in class. And then it went viral. And I said, oh my gosh, I think this might actually be a thing, like a niche that I can potentially go down and teach anatomy, physiology contents, medical contents, physical therapy contents. So for the last 4 years, I've been doing anatomy quizzes. And
they're great.
Yeah, and I try to provide educational opportunities for individuals throughout the world.
I gotta be honest, sometimes I don't take your quizzes because I don't want to get it wrong and be like, can he see that I got it wrong? Is that
there's no revoking of the doctoral degree?
I'm like, I slipped and I pressed that. I didn't mean to press B. I meant to press that. It just shows that, well, there's a lot of information because that's how the internet works. And some of it is great. Some of it's not great. And the only way to sort of combat the not so great or the misinformation is with good information. Like,
right.
I'm sorry, you can't, there's no police on the internet. You can't just say, take that down because I don't like it. The only way to sort of combat that is just produce good stuff. Yeah. So do you approach it like a scientist? Do you look at it and say, because I've done this before, dude, this video is going to rip, it's going to kill, and you put it out, nothing. And then you fling one that you barely put any effort into, and that thing catches fire. And you're like, why? So effort doesn't always equal outcome.
Sure.
What have you taken from this, and what have you learned in doing it in 4 years, which is not a short amount of time?
I mean, I think we look at the physical therapy profession and we think about our ability to problem solve, and whether that be diagnosing an individual with a knee pathology or something like that. I've eventually got myself a master's degree in business, in marketing and social media posting specifically. So I know what kind of content should hit,
right,
and or how to adapt content to potentially not necessarily play the algorithm, but there is strategy behind understanding what will make the society of followers feel the most invested in my content. If I post stuff that's relevant for doctoral students in their third year, no one's going to do it because it's going to be too challenging. And so you have to intersperse, I guess, layperson educational opportunities with some of the more higher level social media posts.
Yeah. Know your audience.
Right. Exactly.
Right. I mean, and I would imagine in a classroom setting, it's easier because you have body language, facial.
Sure.
We'll call it dead behind the eyes. Like, no one, everybody's giving me just a blank stare. Got it. We're going to pivot. We're going to say the same thing in a different way. Let's do that again. On the internet, you sort of don't have that. Yours is delayed, whether or not people like, share, subscribe, rewatch.
Every 24 hours, you get a whole new opportunity, a whole new audience, if you will.
Yeah, I do that. I tell people a lot, like, if you live by the numbers, you die by the numbers.
Right.
So first and foremost, with this podcast, my goal is have fun, learn stuff. And also excuses to wear bow ties and red jackets is always a nice way to go to work. But you get a new set of data which said, hey, this is how this worked yesterday. Funny idea though. Post the same video 30 days apart. You might get 4 views and then 400,000 views.
Exactly.
And that's my answer to that is people are people-y.
Yeah. You got to be consistent. And I think it's finding things that bring you happiness and joy outside of the viewership.
You got to like it.
Yeah.
If you don't like it, doing what you do would be horrible.
And I think for me, I've always tried to stay true to my mission statement, which is providing educational opportunities for the students at the college I teach at. So I teach at Ithaca College, and So I'm posting stuff on the endocrine system because we're learning about the endocrine system. Or
you're mirroring that, mimicking.
I'm trying to allow for them to engage in content that's relevant to the classroom.
In a different way.
In an extra learning opportunity that they can stand in line at Wegmans waiting for their groceries and potentially scroll through their TikTok or Instagram.
You're making me feel bad. I used to live near Wegmans. It's funny. I never really had an opinion about a supermarket until you get one that you love, and then you move away and you're like, oh man, you used to love me at the Wegmans.
These people on the West Coast, they don't know this whole Wegmans thing.
I know. Why do so many physical therapists feel boxed in to one career path? I get it. Like if you're going to do a bell curve, the center of the bell curve, there's one or two ways to be a PT.
Sure.
We also know how wide a bell curve might be. There's a lot. Why do PTs feel boxed in to one way?
I think when you poll the audience of who are physical therapy's personality types, we're very type A individuals, and we follow by the rules. And so those rules involve studying for a test, getting good scores, and so on and so forth. And we have this trajectory that I think has been established as you become a standard practitioner in terms of clinician. You're going to treat 5 days a week.
Yeah, 40 hours
a week, X amount of evals, so on and so forth. And that is ingrained in the vision statement, I think, of the profession of physical therapy. But just as we have a branding problem with the physical therapy profession, I think we have a branding problem of what opportunities does the physical therapy profession potentially allow for us to do. And so I think it takes individuals to step outside that box and be willing to push the social norms of the doctoral program to allow for this upcoming generation of students to be able to see that there are more options out there.
You are a walking, talking example of one of the cliches that I bring up, which is we are not in a tell business. Mm-hmm. We are in show business. And I know people might look at, well, I don't want to do Instagram. I'm like, then you don't have to.
Sure.
But you should still show people. Telling people doesn't work, right? I need to show me. Do you just tell people how to do an exercise? Of course not.
Yeah.
I would show. Oh, they don't get it. I'll show in a different way. I give this sort of cliche too, which is there are these concepts I learned in PT school: frequency, intensity, time, type, volume, progression. Those are exercise principles. Those are also communication principles.
For sure.
If you're not frequent and you're confused at why things don't grow, I'm like, I don't know, you did one push-up a day and then you stopped.
Your load is inadequate.
Correct. So do more.
Yeah.
Well, I don't want to do more. Like that I'm very sorry.
My content's not hitting. Well, you can't go from a yellow TheraBand to a red TheraBand to a green TheraBand and expect that to work.
Correct.
So,
why do clinicians? What do clinicians forget most after PT school? Dude, I knew like origin, insertion, like I knew all of that.
I will tell my students that coming out of cadaver dissection, you will be the smartest that you will ever be.
Right there, dude.
In that third year of PT school,
that's your pocket.
Yeah. And I think it's a lot of knowledge that's not necessarily clinically relevant at times. Like all the branches off the internal iliac artery. When am I going to be ever have to discuss that to a patient? But I think it shows the capacity of learning and the willingness to what's my rating perceived exertion in terms of my tissue tolerance, right? So they can study for X amount of hours and memorize so much stuff. And I think making it through that summer experience shows them that they have the capacity to become a doctoral student.
You're going to learn so much stuff in PT school, and you're going to leave and you're going to go to a setting and you're going to use 28% of it.
Yeah.
And whatever the math is on the other side of 28, you're not. And that's going to go away because that's how brains work. They're made, right?
Yeah. And so I think like some of those fine attachments of like some of these intrinsic forearm muscles, like no one's going to ask you about that and no one's going to care because that's what Google's for.
Right.
And so I think that those kind of things, like if I were to give an exam to my colleagues in the clinic, they probably would do worse than the majority of my students in the classroom.
Because they're doing frequency, intensity. Right now, they're in the thing.
Right.
They're learning the
thing.
They're
doing functional training and not necessarily accessory exercise.
Correct. Correct. Yeah. How can social media be used responsibly for education? I mean, you're an example of that. But what are the things that if someone's like, I have an idea. People always come to me like, I got an idea. You're the media guy. I go, hang on a second. Like, I don't know everything. I just know what I like podcasting because I really like talking to people. I figured out what I liked first and then decided how to use it. So how do you communicate to people how this thing that's on everybody's phones can be used responsibly?
Well, I think if it's from a content generation standpoint, I think share your journey, but don't proclaim false expertise. And I think that idea of you are a first year physical therapy student, share what you're learning within your first year, but don't necessarily try to try to jump steps to say, well, in this how we make patients better. No,
Right.
you understand goniometric measures or special tests. So produce content around that and allow for your educational package to grow.
Scope.
Yeah, your scope to grow as your clinical skills grow. And so I think that opportunity is more authentic. And I think that authenticity through the social media lens would be the way if I had to rebrand myself or restart as a physical therapy student. That's what I would do.
Yeah. Sharing good is the only way to sort of dilute the stuff that maybe is inaccurate or dangerous.
Right.
Yeah. What do you get most joy out of? The comment, like what I'm like, imagine like seeing how many people interact with the thing that's like, oh, like people are like doing school stuff on Instagram.
Well, I mean, 5 minutes before we hopped on this, I had 2 students from the University of Florida come by and say, we do your quizzes all the time.
And I got a geography lesson for you. Ithaca is not close to Florida.
It is not, right?
But Instagram is in your pocket.
And so I think it's seeing the joy that people get out of the content, because I get so much joy and satisfaction from teaching. And my capacity to teach is limited to 180 students every academic year. But now I have the opportunity to expand beyond that through the palm of your hand.
And the maths, like, you make a 1 minute video. I'm sure like some of your, you can see analytics, like a 1 minute video that's seen X number of times. Like we're not measuring in hours or days. You're measuring in weeks or months worth of exposed time. And that's powerful. That's compound interest.
Yeah.
And then you could reshare that same video because I know things change, but anatomy and physiology, that stuff's going to be good.
Human bodies
next year, right?
Yeah, for
pretty sure it's going to be kind of close, right?
Yeah.
Or pretty damn close.
Yeah. No, and I think that's the benefit that every year I get a new academic cohort and I get an opportunity to rebrand the content that I've been doing, but challenge myself. How can I do it better? So just as I'm trying to teach differently, I'm also trying to utilize the social media platforms in different ways.
Adapt the method, right?
Exactly.
And that's the thing. The platforms are changing too, because what human brain craves novelty. We crave the novelty. I'm wearing today a tuxedo with a red jacket. I'm not going to wear this tomorrow.
Sure.
I'm just not, because I know on day 2 of CSM, everybody's sort of burned out. It's all, right? Everybody's just sort of like, because we're going to go out tonight. I'm not going to stand out. The platforms change.
Yeah.
Instagram used to be photos. Then it became super short videos. Now the videos can be longer, but now we also have these buttons, and we can ask a quiz, or we could do a tag, and we could do all those things. So understanding the physics of whatever platform you're on, because whatever you're doing on Instagram doesn't necessarily perfectly align with another platform, because they're similar, just not the same.
Yeah. And so content delivery on the different platforms has to be molded towards the platform itself.
Can't break the rules.
Yeah.
I mean, you can bend to them. But I would always say, I liked when someone asks you to think outside the box. First, you got to have the box. It's okay. You can do a video, and it's going to be very like there's all these parameters, and then you get to be creative and go, how do I solve this?
Yeah. Here's the initial scaffolding, but the building's going to look different.
Correct. You put whatever you want through it,
right?
Which is pretty exciting.
Yeah.
So you mentioned when you talk to people, or you might have colleagues that are 1, 3, 5, 30, 40 years out. How can PTs continue learning without burning out? When you're a student, your prime directive is wake up, learn, go to sleep, learn. When you're in clinic, there is a learning there, but maybe some of the things are falling off. So what do you suggest for clinicians to do who want to be that triple L lifelong learner?
Well, I think I always leave CSM revitalized, and just having the opportunity to collaborate, meet people, and see the excitement within the profession. And I think that the monotony of a day in, day out practice sometimes is what creates that element of burnout, when there's notes to be done and
no novelty.
Yeah. And so I think that you have to challenge yourself to grow outside the typical way that you would treat a patient. And so I've had practitioners that will treat everybody in standing, or treat everybody in the gym today, or challenge the way that you typically do the normal, because the recipe book, if you follow it day in, day out, you might get the clinical outcomes that you're looking for to an extent. And obviously there's elements of novelty to each of those patients, but you are not challenging that neuroplasticity component. You are just riding that groove. And so I think that challenge yourself to explain something differently, or to not use the word pain. That's one of my sort of clinical pet peeves. How can I educate better? How can I have the opportunity to communicate differently?
Yeah.
And I think that stays there. That keeps the concept of the profession new, novel, and exciting. So
yeah. Same as a social media platform.
Exactly.
We're gonna give you rules. We used to do this thing, and I stole it. I forget the name of the movie. There was a Steve Martin movie where he was like a preacher.
Okay.
And he was essentially just like, it was a circus going from town to town. He was a hustler. He was a grifter, right? And he would have a hearing piece in his ear, and his team would give him a ridiculous word, like vinyl siding or horseshoe. And he would be up there preaching, and he would have to somehow make it relevant. And they were betting whether he could do it or not. But that just shows you, it's like, I'm going to do the same thing, but today everything's going to be in half kneel. It's like, you can't do that. It's like, all right, well, let me work this problem. And what you're doing is you're stressing that neuroplasticity. It's like, I'm going to try this differently. And that's when serendipity happens, or you discover a new thing, or today was just novel and it felt better. And I got through the day faster.
Right. Because you never know which patient's going to require that.
Correct.
And so I think that challenge yourself every day you walk into the clinic, and not just go through the motions. And I think that in itself is what.
And then I'll give a little grace. That's simple. It's not easy.
Sure.
So do it a little bit.
Yeah.
And then try some more, and then maybe get excited about it.
Right. One new thing a week. That's 52 new things a year.
I like the math on that.
Yeah.
What's one unconventional path more PTs might consider? Are there things out there that you're like, hey, more people should know about this?
Well, I think not necessarily unconventional, but I had an unconventional way into academia. And I got a text message saying, would you want to teach night labs? And I have no PhD, EDD, DSC training. All I had was a clinical doctorate. But I think that concept of, I had a passion for communication, I had a passion for teaching, but never even thought when I graduated PT school that education was a direction that I would be able to go in. And so I think it's be willing to volunteer and teach that class, or put on that platform or seminar in your local community, and then allow that to sort of see what opportunities stem from that, because that one lab section turned into 2, which then turned into 4, which then turned into a full-time position. And so I think for me, I wouldn't be where I am today without my physical therapy degree. And I wouldn't have, the social media platform or the book or the opportunity to be an academic if it wasn't for allowing myself to step outside that box.
Say yes.
Yeah.
Right? Like, how bad could it go?
Sure.
Right.
Yeah.
How do you help people rediscover joy in their work?
Ooh. Yeah. That's a big question. And I think that opportunity, finding joy in their work, you have to find joy in yourself first. And so I think that idea of, in the book, one of our interviews, we had this concept of micro joys, not macro joys, because I think we live for the Christmas, the spring break, the summer vacation. Right. And then we sort of pedal to the metal in between these large joy events, but then we have to intersperse micro joys. And I think that finding those small things that bring you that happiness on a daily basis, and having 4 or 5 different things that can also bring you happiness in case, the sun's not out, it's going to be a bad day. Well, no, but I can still read a book. I can still do X, Y, and Z. And so I think that finding what within the profession, what within your occupation is the thing that brings you happiness. For me, it's having the opportunity to communicate. And so if I go through a day and I don't have a chance to communicate with students,
you get itchy.
I get itchy, right? So now I have to figure out, what are the other opportunities that also facilitate that? But what can I tap into when I'm not teaching?
Kind of look for it.
Yeah.
Right. If you're not looking for it and you're waiting for it to show up, it might, but it also might not.
You have to go out and get it.
We have a tradition on the show.
Sure.
It is called the parting shot.
This is the parting shot. One last mic drop moment. No pressure. Just your legacy on the line.
All right, parting shot is brought to you by U.S. Physical Therapy. We're at their booth right now, doing a live stream. Hi, everybody. U.S. Physical Therapy, a nationwide network of clinics focused on developing clinicians and not burning them out, showing them the micro joys. Leadership tracks, mentorship, career growth. What does it look like for you? USPH supports PTs who want to build real futures in this profession. Find them online at usph.com. That's usph.com, or in the expo hall, which is where I'm standing. All right, so your parting shot. What's one question PT should ask themselves to find what actually makes them happy? What actually makes them happy?
If you could not show people what you were doing, would you still do it?
Say it again.
If I could not tell you, if I could not show you, if I could not post on Instagram what I'm doing, would you still do it?
Oh, it's a great question.
I think we live for that Instagram highlight reel. But at the end of the day, if you'd still do that, like for me, I enjoy climbing mountains.
Right.
I would still climb a mountain if I couldn't put a picture up from the summit.
And I forget whose quote it was. I'll give him props later, but there's two reasons to climb a mountain. One is so the world can see you, and the other one is so you can see the world, and you see which one is a little bit more.
Yeah.
You know.
So if finances weren't a part of it, what would you still do?
Yeah. Great parting shot. All right, Tim, appreciate what you're doing. Just make sure I'll put it in the show notes, but make sure everybody knows the Instagram account.
Yeah. It's anatomy_professor and at TikTok, AMP_professor. Love to see you there.
Keep doing it. Well
Thanks,
done. Appreciate you stopping by for CSM.
Yeah.